Hello, this is Dr. David Green, CEO of the Washington Pain Network. The topic today is what you need to know about lumbar sympathetic blocks. A lumbar sympathetic block is a procedure used to relieve pain in lower extremities from several neurologic and vascular conditions. The sympathetic nerves emanate from the lower lumbar area, right around the aorta, and they regulate a lot of activities that are behind the scenes, either activating sweat, dilating blood vessels, the fight or flight phenomenon, and this is called the autonomic nervous system. So those who have RSD and CRPS do well with the lumbar sympathetic block. Phantom limb pain, post-herpetic neuralgia, shingles, cancer pain, pelvic pain, and non-operative peripheral vascular disease. So for the procedure to be performed, it's as an outpatient. The patient is placed on his or her stomach on an X-ray compatible table. Usually IV sedation is administered. And some pain doctors go unilateral, others go bilateral. Fluoroscopy is a real-time form of X-ray, and that helps for accuracy. Oftentimes, once the needle is in position, the pain doctor will insert some dye to make sure that they're happy with the placement. And then they'll go ahead and insert the numbing medicine, maybe some steroid, possibly phenol, which is an alcohol derivative. It helps with longer lasting pain relief, and maybe even a radiofrequency ablation, which is a pulsed thermal energy that can help with longer lasting pain relief. So here you see a person laying on his or her stomach. You have the needle going in around the spine and then going right around the sympathetic on this side, and then if it did it on the other side, it'd be right here. Are there risks? There's a small risk of infection, nerve injury, bleeding, allergy to the anesthesia. There's also a very small risk of a dropped lung or some temporary numbness due to the injection. Right away, if the injection was done properly, patients will typically notice an increased temperature in the leg and the veins feel full. So this is normal. It means the block was positioned correctly. A temperature increase of 2 degrees Celsius means it was successful. So if the person's only having left-sided symptoms, you would just do it on the left side, right? If they're having bilateral non-operative peripheral vascular disease, you would do it on both sides. The outcomes with our sympathetic block have been shown to be excellent for pain relief for those with RSD and CRPS, because oral opiates and narcotics, they just don't often help with those types of conditions, so this type of procedure can be, a lifesaver. The top non-operative pain management in the state of Washington is through the Washington Pain Network. There's multiple clinics that offer over 25 treatments. Over 50 insurances are accepted. The average pain relief success rates are over 90% with the board-certified award-winning providers. Visit us online at washingtonpainnetwork.com and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the Washington Pain Network. Your pain stops here.